Good morning. May is Mental Health Awareness Month. With that in mind, today we'll take a look at what's being done here in Michigan to increase the number of behavioral health professionals. Eric Doeh, CEO of the DWIHN Integrated Health Network, and Dr. Sheryl Kubiak, Dean of Wayne State University's School of Social Work, will join me. And later on our Sunday morning program, we'll tell you about a new WXYZ WMYD initiative that allows for removal request of some action news stories from our system that could help people get a second chance. Jeff Kernan, news director for TV7 and TV20, will explain. It's Sunday, May the 8th, Mother's Day. I'm Chuck Stokes, and this is Spotlight. Dean, you deal with this in an academic setting every day. Paint the picture for us. What's going on?
So thanks so much, Chuck, for having us. It's really important to both of us to be here and talk about this issue. As many know, the behavioral health issues that have arisen because of the pandemic have really accelerated the need for people with professional degrees in mental health, substance use disorders. And unfortunately, prior to the pandemic, we had a shortage of professionals in those fields, particularly in public sector mental health, community mental health, which Mr. Doeh is the president of DWIHN and is acutely aware of this. But it's so accelerated now that many of our organizations and community providers have up to 30% of vacancy rates. And that's resulted in closing programs and wait lists that really, it is not the time to do that. So from an academic setting, I'm trying to encourage people to come into this profession, but we have some hurdles. We've got, high cost of tuition and low wages. So it's not the greatest environment, but it is very worthwhile. And we're working on some of those environmental issues. And that's where Eric and I have teamed up quite a bit.
I am an admirer of Sheryl Kubiak. So, teaming up with Wayne State was an absolute common sense thing to do. You're talking about a neighbor that's right within our backyard here. And we are both working towards the same thing. One, I have an issue where I have vulnerable folks who need clinicians to provide services, to and for them. Sheryl has an academic institution that welcomes folks wanting to serve, within our communities. And so when you have that void where folks are not coming into the profession, it is just a common sense, reasonable thing for us to do, to put our heads together to figure out how can we both complement each other. And that's where we are at this point.
Are things being done in Lansing to help improve the situation? Dean?
Felicia Brayback from Washtenaw County is actually introducing some supplemental budget that would provide for 1,000 new social workers across the state. So we're hoping things like that happen. The loan repayment programs haven't really been successful because they require people to work for 10 years before they can have any relief. And on a social worker's salary, 10 years is a long time. So we're hoping that we can incentivize things like payments for stipends for the internships that students do. Students have to do 900 hours of internships in community organizations. They pay tuition for that, but they often can't work those hours because they're in agencies. So we're also hoping, we've written to foundations trying to get support and programs that will keep students in public behavioral health settings.
All right. Okay, we need to take a quick little break. When we come back, I'll pick up with you, Eric Doeh, and let you weigh in on this as well. We'll be right back. Stay with us. And welcome back to Spotlight. Eric Doeh, I had to get a little break in there, but we're back and wanted to give you a chance to weigh in on the question that I originally posed to Dean Kubiak.
Sure. there is a tremendous amount of paperwork that is connected to behavioral health within the public space. And when you have gone to school to become a social worker, and you want to focus on treating and caring for folks. And so if a health plan or another private entity is offering you a similar opportunity and that involves less paperwork, some folks we're finding are gravitating towards those opportunities. When schools are competing for the same workers that we are, and then you also have, Dean Kubiak trying to attract, students into her academic institution, it creates for a very dire situation now where we have money going into schools to attract clinicians, but you don't have enough folks entering the field. And then you have on the mental health side, we have a lot of our providers who are, having to hire or avoid, some of them 30%, in terms of their workforce have been depressed. So all of those things trying to balance, it's not an easy thing for a vulnerable population.
Sure. Dean Kubiak, I want to bounce back to you for a second. Some of the supplemental funding that you talked about, is Lansing getting the message? Because when we look at some of this, they're cutting out some of the stuff that you're lobbying for.
Yeah. I hope they're getting the message. We're trying really hard to get the message out. I think that sometimes when we think about healthcare professionals, it's not a one size fits all. And so where we have funds that go into support for other healthcare professions, like tuition support for nursing or psychiatrists, that doesn't generally filter down to social workers. Yet social workers are the #1 provider of behavioral health services, not only in this state, but nationally. And so the awareness of what social workers do on the front lines, and as Eric said, this is not easy work. It's difficult work when you're carrying the load of other people's trauma, other people's access to resources. So it's not for the faint of heart. But I think they are providing a dire community service. And we've got to recognize that if we're going to promote this kind of service in our community and this kind of support for individuals in our community, that maybe we have to shoulder some of the cost of that we shouldn't put that all on the students as they're trying to seek this profession.
Sure. Eric Doeh, how much of this is being driven by those who perhaps are more interested in privatizing this care as opposed to having governmental agencies deal with this? And long term, would that be a better solution, or will that hurt what we are trying to do in terms of delivery of healthcare services?
What a wonderful question. Chuck, to be fair and also transparent too, those forces will always be there. I don't think those forces, in terms of folks who are trying to privatize this, are necessarily the reasons why we have the shortage of that exists within the workforce. This shortage has always been there. It's just that now COVID and other aspects in our communities seemingly they have exacerbated them. And what I mean by that is this: when you have now monies that are being poured into other professions or into other avenues, people now have a choice. If your nearby fast food is now hiring at $25 an hour, and you figure folks within our space are having to start at $12 an hour, that's a huge difference. Or you're talking about someone who've gone to school, who've earned a master's degree, but is going to start off somewhere between 50 and 60,000, where they can go into the private field starting off at 75, 80,000. There's a huge difference there. Without a doubt, though, privatizing this is going to make it even more difficult, because now you're talking about a situation where private companies, they have dividends and all of those things to be concerned about. And so, utilization levels that they have to be concerned about. Within this space here, Chuck, there are other concerns that we have that folks don't consider in the private sector. For example, transportation, whether folks, can get to that place to receive that care, whether they've had something to eat, whether they have a roof above their heads. Those are all aspects that are part of community mental health. And you cannot leave those things when you are having these discussions about, the shortage that exists within the workforce.
Sure. Dean Kubiak, I'll give you the last word. You're competing against a lot of professions out there when young people go to college and try to decide what is it I want my future to be. What's the best and most rewarding thing about this field that you can say that would make a young person watching this program say, okay, I want to do that?
I love social work because the profession is so versatile, but it's not only concerned with just the individual in front of you, but it's also concerned with the context around that person. And so social workers are trained not only to help the individual, but to see what system changes are necessary to support that individual. So having that duality of focus on both the individual and the community or the context makes me feel like I can get up in the morning, because I'm not just putting a finger in the dike. I'm looking at how are we rebuilding the dam. And that's what I'd say. That's the excitement, I think, about social work. And I've been doing this for my whole life. And that's why I love this job, because it's easy for me to talk about what's important about this work.
All right, and when you get right down to it, it's about the village, taking care of the village. Dean Sheryl Kubiak, Eric Doeh over at DWIHN Integrated Health Network. Thanks so much for joining us today on Spotlight. We'll stay in touch with you on this very important issue, and obviously one that's evolving and transitioning and changing as you're lobbying legislators in Lansing and everywhere else. We'll try to do our best to keep on top of it as well.
Thank you so
Thanks
much.
so much.
Thank you so much, and have a great day, and thanks for joining us today on Spotlight. And coming up, I'll talk to Jeff Kernan. He is the news director for TV7, TV20. He'll be talking about our story removal request process, something brand new that really impacts the public. We'll be right back. Stay with us. And welcome back to Spotlight. Joining me now is my friend and colleague, Jeff Kernan. He is the news director for WXYZ, WMYD, Channel 7, and Channel 20 Action News. Welcome. Pleasure having you on Spotlight.
Good to be with you this morning, and good morning, Metro Detroit.
Absolutely. You've been in the news business a long time, and so you can testify to the fact that once a story is done and it hits the air, it takes on a life of its own, and trying to get that genie back in the bottle, so to speak, almost never happens, but there's an attempt to try to maybe alter that to some extent, correct?
Chuck, there's no question that our work has impact. Certainly impact in terms of informing Metro Detroit of what's going on, or any city across the country, and has impact on those that we report on. In whatever circumstance that individual may be involved in a story. And to your point, that it lives on. Certainly, it always has lived on in a way on broadcast, but as digital and social media has evolved and has become so important in terms of audiences and consumers consuming our content and the journalism we provide, certainly those stories remain on almost forever. You Google, right? The first thing we do is we Google something. And, we would get over the years occasional requests from people that we've reported on saying, you have had this story from a couple of years ago. I was involved in a situation that was part of news coverage. Mm-hmm. And I'm trying to get on with my life, and whether they're
oftentimes those are misdemeanors.
Exactly.
We aren't talking about felonies where somebody is
some kind of a situation that might be embarrassing at the moment, requires some kind of news coverage, and it has lived on. And we would get occasionally those requests over the years of somebody saying, "Hey, would you take that down?" I think where we're at now, Chuck, and not only here at WXYZ, but our parent company, Scripps, across all of our stations across the country, is trying to take a more...
Which is a big number, we should
Exactly.
say, 60 some
You
odd
know,
stations from coast to coast.
a holistic approach to it in terms of being accessible, certainly accessible to Metro Detroit, to our audience, but being accessible to those people that we report on. And trying to be responsive to their ask of us, would you edit or take down a story? And so we are now actively receiving and actively trying to be responsive to folks who will ask us, would you edit or take down a story that has been out there for years? And to your point of it's not nonviolent, a misdemeanor.
Well, that was going to be the question,
Yeah.
because people are going to say, okay, we're talking about misdemeanors and stuff, but what type of things will you not consider?
Absolutely.
Yeah.
We will not take down stories that are felonies. We will not take down stories of violent crimes, including sexual assault and those kind of violent crimes that people might have been involved in. And we will not take down stories, or we are likely not to take down stories involving public officials, those who have the
They're
public
held
trust.
to a higher trust.
Held to a higher standard.
Yeah.
And people need to be able to find out about something that may involve somebody that holds the public trust. And therefore, those individuals, they're evaluated and they're considered in a different way. And so we are not likely to take down those stories involving, again, those folks that are public figures, those that hold the public trust, and certainly those stories that involve violent crimes, felonies, sexual assaults, and those sorts of things.
Are these requests that will be made on an individual basis, or is it just a blanket thing? And do you maintain control as an editorial staff to be able to say, this case, we feel
That's
it's
right.
warranted, this one is not, and so people don't just inundate you saying, everybody gets a free card now.
Individual requests not lawyers on behalf of individuals, but Chuck Stokes is going to submit to us, WXYZ, through a form on our website, WXYZ.com, and you're going to say, my name, my date of birth, here's the situation, here's the article that I was involved in. That will be then submitted. And internally here at WXYZ, including our staff that we have involving our Equity, Diversity, and Inclusion committee that we have here, will consider that. Is this the right thing to do? What is this particular story? How long ago is it? This person is trying to get on there with their life. Should we edit it? Should we take it down? There'll be a formal process that we will consider on an individual case-by-case basis.
Okay, hang on a second, gotta slip a little break in here. We'll come right back with a couple more questions. Stay with us. And welcome back to Spotlight, talking to Jeff Kernan. He's the news director for Channel 7 and Channel 20 here at Action News. Jeff, what do you think the overall impact of this may have in terms of our community, and obviously on individuals it's going to have an impact, and how that has changed in the amount of time that we've been in the news business? Because when we first got in, there wasn't this internet, there wasn't this thing. And what power do you have in terms of what you take down? Is it just on our websites? If something gets up on, say, YouTube and other places, do you have any jurisdiction for that, so people really understand?
Sure. Chuck, I think more than ever before, we have a responsibility to our community. I think that we have and a responsibility to those people that we cover. And as I mentioned, I think we have more than ever before the need to be accessible to those folks, and understanding that the consumption of content, before it was just broadcast, right? Channel 7.
Right.
And now it is various digital and social platforms. We have control only over what we have control over, and that's WXYZ and WMYD.com. And we will be responsible for those platforms, or the platforms that we have control over. And we'll make the decision based upon the request from the individual and the information that they provide. They might provide us court documents. this has been adjudicated, this has been satisfied with the court, whatever the case might be, would you edit or take this down? And we will responsibly review that. And in an effort of being responsive to not only Metro Detroit, but those people that we cover, will make a decision. Folks are looking to have a second chance.
Sure.
And to move on with their life.
And oftentimes I imagine, even though you can't control what other sources, media sources do, it's sort of like leading by example. And how unusual is it for a media company like Scripps to do something like this in this day and age? I think it's pretty advanced.
I do think so, and I think the challenge is there for us to continually think about the impact we have in the communities we serve. Not only in terms of informing the public of what's happening in Metro Detroit, and that's the good, sometimes the bad, and the challenging and whatnot, but also after the fact. And I think that there's a responsibility, a growing responsibility, that we as journalists, that we as a journalism entity have in terms of after effect and in the impact that our work has, not only for the here and now, but also going forward.
Final question. This is new. We want to emphasize that if you're interested in this, just go to our website at WXYZ or WMYD. I imagine you'll be evaluating this. The entire corporation will be evaluating this and to see how it goes, but it's very forward thinking.
That's right. WXYZ.com, WMYD.com, and on the menu bar, you'll see a request for removal. There's a form there, you'll fill it out. Fill it out as completely as possible, and we'll begin to evaluate those on a case-by-case basis and make the best decision that we can. Again, not all requests will be granted. I mean, we talked about that previously. And what's the next level to this? We'll keep looking at it. I just think it comes down to the responsibility that we have here in servicing Metro Detroit as a responsible journalism organization.
All right, real quick, Pistons are not in the playoffs, but you came most recently from Milwaukee, Wisconsin. I noticed you have green on. Is that a little slide there? Are you rooting for the Milwaukee Bucks since the Pistons aren't in there?
You got to go Bucks, is what I'll say. Giannis Antetokounmpo, how's that? I had to learn how to pronounce that.
You remembered well. All right, next year the Pistons will be in it. You got to change.
And go Pistons. That's exactly right.
Jeff Kernan, thanks so much for joining us today on Spotlight. It's a pleasure having you.
Thanks.
And I'm Chuck Stokes. We'll be back next week with more newsmakers in the Spotlight. We hope you have a great week.